How to wean off Suboxone. Suboxone is an effective treatment for opioid addiction, but like any other opioid, discontinuing Suboxone can cause withdrawal symptoms. These symptoms' severity depends on the duration and amount of Suboxone used. This video discusses the safe ways to wean off Suboxone, the withdrawal symptoms, and the importance of medical supervision. Patients receiving treatment for opioid dependence with Suboxone should understand the risks associated with sudden discontinuation of treatment. It is often not recommended to abruptly stop Suboxone without medical involvement, as the withdrawal symptoms can be severe and potentially more dangerous than other opioids. Therefore, it is essential to discuss with a doctor the best ways to wean off Suboxone safely. Common Suboxone withdrawal symptoms include low energy, loss of appetite, irritability, muscle weakness, withdrawal insomnia, increased sweating, shaking, feeling cold or hot more than usual, watery eyes, runny nose, diarrhea, vomiting, and goosebumps. Suboxone withdrawal can last for a few days to several weeks. The intensity of the symptoms will depend on how long you've taken it, the amount taken, and any other medications used. Medication-assisted treatment, or MAT, is an effective approach for safely weaning off Suboxone. MAT combines Suboxone with counseling and behavioral therapy. MAT helps reduce cravings and provides counseling and other support to help patients transition successfully from dependence on opioids to an addiction-free lifestyle. It also helps address mental health issues, such as depression and anxiety, which may result from long-term opioid abuse. When weaning off Suboxone, tapering is the most commonly used method. Tapering is done by gradually reducing the dose of Suboxone over time until the patient no longer needs it. Generally speaking, it can take anywhere from a few weeks to several months, depending on the individual's level of dependence and the severity of their symptoms. If it is done correctly and with guidance from a medical professional, tapering off Suboxone is considered safe. You must understand that not everyone will experience the same withdrawal symptoms when they stop taking Suboxone. But for those who do, it's important to remember that the intensity of these symptoms will vary depending on several factors, such as the time on Suboxone, medical history, dosage, and other medications being used. When tapering off Suboxone, there is no one-size-fits-all approach. Some people prefer a short taper, while others may opt for a longer, more gradual process. A short taper is considered more effective for those who have been on Suboxone for a shorter period or whose symptoms are milder. On the other hand, a long taper is better suited for those who have been using Suboxone for an extended time and have severe withdrawal symptoms. Stay consistent and committed to getting the most out of your treatment, no matter which tapering method is for you. Relapse can happen when weaning off Suboxone. It is a part of any addiction recovery journey and is not indicative of failure. The best way to avoid relapse is to stay consistent with your tapering schedule, remain committed to the process, and seek professional help when needed. The best thing to do when you relapse is to get back on track with your tapering plan and continue to seek support from medical professionals and counselors. Your medical professional can help you create a personalized tapering plan that fits your needs and goals. They can also monitor your progress, provide additional support or treatment resources, and adjust your plan as needed. If you're having difficulty dealing with withdrawal symptoms or relapsing, it is easier to handle if you have a medical provider to help. If you are struggling with opioid addiction and want to wean off Suboxone safely, seek professional help today. At SuboxoneDoctor.com, we understand the importance of having a support system and medical professionals to help throughout the process. Don't wait. Start your journey to an addiction-free life now. Visit SuboxoneDoctor.com for more information.